So, we are here with my sister today, and really we've done mostly machine treatments with my sister. So really when we start talking about machine treatments and what we're doing today called a biostimulator, our goal is to treat you appropriately, treat you in such a way that you continue to be you. We're not trying to have so many patients to say, I just want to look like myself. You're always going to look like yourself if we have anything to do with it. And when we do biostimulation and machine treatments, what we're doing is activating your body's ability to do a better job of improving production of collagen and elastin. So that's one thing we have done a lot of. She's had several IPLs, which are going to help with pore size reduction. It's going to help with pigmentation of the skin. It's going to help with mild collagen stimulation. That's one that you've done several times. Her main concern, well, tell me what your main concern is.
So I feel like my face is falling off, I'll say. It's just lots of heaviness at the bottom, and I'm losing volume right here in my cheeks.
So when I look at, so you think, okay, what does an injector see or your aesthetic provider see? So Jennifer has amazing cheekbones, beautiful eyes, and where her struggle is really what I call the women's beard area. So when we talk about what we see centrally, we need to start giving some volume back here. So what we're going to do today is treat with something called hyperdilute Radiesse. So Radiesse is a filler that we use as a filler all the time, but when we dilute it down with saline, it becomes a biostimulator, a really potent biostimulator. So we are going to help create a little bit of volume from cheek to what we call your submalar area. So when we can transition, when this transition is softer, it gives a more youthful appearance. So although that's not exactly what your mind is going to, I don't really want to look 20. That's not our goal. Our goal is to age gracefully, however that looks for you. It may not be an injectable, it may just be machines, and that is 100% okay. But at some point, I'm probably going to suggest something like a Sculptra or a hyperdilute Radiesse, and that is where we're at today. We don't want it set for long. We are mixing it. So this has Radiesse in it and bacteriocide on the saline. And we mix, and then we put it back into our syringe. There we go. And it's ready to go. You good? Feel that? Feel it? And really where we're at is what we call deep dermis. And we are going to just lay a few struts. Doing okay? So I love Sculptra. It is what I have been using predominantly for years. But one thing we've really started looking into is how does it work? And one thing that you'll get out of, well, there's several things you'll get out of hyperdilute Radiesse that you won't get out of Sculptra. And that is new elastin formation. And elastin is very important in our skin integrity and how we, I call it the bounce back of our skin. So sometimes as we age, you see that your skin doesn't return if you pinch it. It doesn't return down to baseline very quickly. It takes time. And elastin is part of the reason. So Sculptra does not affect elastin production. But one other difference between a Sculptra and Hyperdolite Radius is the type of collagen that we get, collagen formation. And Sculptra has a more inflammatory response, and Hyperdolite Radius has affects collagen 1 and 3, and it is a more I'd probably put it more along the lines of the collagen that works best in the anti-aging spectrum. So.